Thanks, Peter Tal. So if I can add my welcome to the first Personalised Medicine World Conference in the UK and in fact in Europe. My name is Jonathan Sheldon. I lead healthcare globally for Oracle. That includes the personalised medicine area, which is my own background and personal passion, as it were. And it's an area we've invested heavily in at Oracle over the last 5 or 6 years, as many of you know. And since its inception back in 2010, PMWC has worked alongside Oracle and Stanford to provide a venue that brings together a multidisciplinary group of those at the forefront of personalised medicine, committed to see this exciting area realise its true potential to transform mainstream healthcare. And when we spoke to Tal and Gadi about the opportunity to bring the PMWC event to Europe, the UK seemed a very logical choice because of the Genomics England project, as did Oxford, and the opportunity to co-host with Peter's Wellcome Trust Centre for Human Genetics. Oxford is also my hometown, which is purely coincidental. We have a world-class agenda for you, for sure, of international speakers. And the timing of the event really couldn't be better with the recent announcement by President Obama in the State of the Union of a precision medicine initiative formed around creating a very large national cohort of over 1 million individuals. And Eric Green's going to provide an update for us later on in the programme on that. And then, of course, as was mentioned, we've got the UK Genomics England 100,000 Genome Project, and Sir John Chisholm, the Executive Chair, and Mark Caulfield, I believe later in the week, are going to provide an update on that. To close, I just really wanted to leave you with some food for thought, as it were. So, in addition to the personalised or precision medicine area, the other major healthcare trend is that of population health, which is basically how you manage clinical and financial risk in a defined patient population under an accountable care or pay-for-performance type of arrangement. So in other words, how to keep a defined patient population as healthy as possible, minimise the need for expensive interventions such as hospitalisation or emergency department visits. So focusing on the high-risk patients that generate the majority of healthcare costs, but importantly also addressing the preventative and chronic care needs of every patient, not just those in front of the physician. So really it's a shift for sort of fee-for-service to fee-for-value. So precision medicine and population health management have emerged as major healthcare trends in isolation up until now. But in fact, they're highly synergistic. And in a precision medicine-enabled population health strategy, that population just happens to be defined molecularly, as opposed to a more standard routine lab test such as a hemoglobin A1C score, for example. So what I'd like to suggest really is in the next 5 years, we're going to see a great deal of activity in that intersect between these two major healthcare trends that will drive really the transition from clinical research to clinical care.